technology that could change the way you're diagnosed with other illnesses. Dr. Randy Shuck has more on the new MRI-compatible pacemakers. Joining me now are two doctors via Skype. One is Dr. Lee Friedman, a radiologist local in Florida, as well as Dr. Mark Silvan, who is a cardiologist. Thank you both for joining us today.
Thank you.
So we're going to talk about pacemakers. In Florida, obviously, we have a lot of people who have pacemakers or need pacemakers. But kind of a surprise, Dr. Friedman, who is the radiologist, actually tells us that he had to have a pacemaker. So just going to delve a little bit on the side and kind of go a little personal and ask Lee if he would be willing to tell us why he has a pacemaker.
Absolutely. I mean, it was not something, obviously, that I thought I would ever need. At the age of, I'm 40 now, I got it 3 years ago. I was 37 years old. I was healthy, in shape, but I was having episodes of passing out, of syncope. And, I got, actually brought to the emergency room in the middle of the night one night. They tested me, everything seemed fine. So I then had some follow-up testing in my cardiologist's office, and they put me on a tilt table where they have me lie flat for a little bit and then stand me up. And when they stood me up attached to this table, I basically passed out again for about 20 to 30 seconds. And so at that point, they told me I was going to need a pacemaker. And being a radiologist, I see patients all the time that have the traditional pacemakers, and they can't get access to an MRI, which is so important for diagnosing stroke and cancer and fractures, amongst many other diseases. And so I was very hesitant to get this pacemaker. So I joked around to my cardiologist and said, when are you guys going to get an MRI-compatible pacemaker? And I was fortunate enough that 3 weeks prior, the Medtronic SureScan pacemaker had been released by the FDA as the only approved pacemaker for MRI use. And that was the one I got, and hasn't interfered with my ability to do my job. And now I know down the road, if I ever need an MRI, I can get one.
Cool. All right, so Dr. Silver, tell us about this new pacemaker. And first, let's go with, obviously, why we need a pacemaker. There's a lot of people in the world who have one. And then go to the differences between the old pacemaker and this new one, if you would, please.
Sure, happy to. So, for the most part, pacemakers are for people with slow heart rates. Anytime your heart rate's under 60, we call it bradycardia, which is Latin for a slow heartbeat. But people who have heart rates that are slow, who often have symptoms of either lightheadedness or passing out spells like Dr. Friedman, or people who get out of breath when they exert themselves, these are symptoms that can be from a slow heart rate, and it's those people that we think about putting pacemakers in. Now, the difference between the old pacemakers where you can't have an MRI and the new type of pacemaker where you can is not something that you can see. Here is a pacemaker, and there's no way you could tell by looking at it whether it's one that's okay in an MRI machine or not. But after about 15 years of research, engineers developed very special circuitry and electronics that could withstand the enormous magnetic fields that are generated by an MRI machine. The strength of the magnetic field in an MRI machine is 30,000 times stronger than the Earth's gravitational, magnetic field. So it's very strong, and electronics are very sensitive to those types of fields. Fortunately now, when I put a pacemaker in a patient, instead of saying what I used to say, which was, man, you can do anything you want, you can live a normal life, but you can never have an MRI, I don't have to say that anymore. Now you can lead a normal life, and if you ever need an MRI, you can have an MRI.
Awesome. So here's some old stuff that everybody talks about. Pacemakers around electronic equipment. I know we're going off just a little bit, but these are common questions that patients ask me all the time. What about microwaves, cell phones, things like that? Any major issues with that?
Yeah, for most household stuff like microwaves or cell phones, there's really not an issue. We generally tell people, if they're going to talk on a cell phone for a long time, to use the ear opposite the side that the pacemaker is put on. Pretty much anything at home is fine. It's usually when you start worrying about industrial-sized generators or welding equipment that there really is ever an issue in terms of any interference. And with microwaves, as long as you don't get inside the microwave and turn it on, you'll be fine.
We'll try to avoid that. Dr. Friedman, now tell me, for the people, there's like 1.5 million people who have the older pacemakers, and if they can't have an MRI, what should we be asking for or looking for when we go into the doctor with maybe some symptoms?
Well, I mean, if they can't get the MRI, unfortunately, there's very little other things you can do. I mean, there are other imaging modalities you could use, like CAT scans or CT scans, but that uses radiation. Sometimes, depending on what we're looking for, it's not as sensitive for picking up the diseases, and so you could have delays in care, delays in treatment, and poor outcomes or worse outcomes if they were not able to get that MRI. So unfortunately, with the new device, you can do all that and get the MRI, but if they have the old device, unfortunately, and I could let Dr. Silver answer this more as an implanting cardiologist, I mean, there's not a lot you can do without removing the entire pacemaker system, or there are a couple of places that will take the risk and put the patient at risk, put the hospital at risk, and the physicians at risk by putting these traditional pacemakers in the MRI environment.
Real quick, what other things can't go in an MRI? If I have a hip replacement or if I have staples, any of those things that our patients should be looking for when they go in to have an MRI to tell their doctor?
Well, I mean, yeah, when you're going in for the MRI, I mean, they always screen you. There's a screening form asking you all sorts of questions, and the funny thing is, the first thing on that is usually if you have a pacemaker. Well, nowadays it makes a difference which pacemaker you have, because not every pacemaker is being put in today is an MRI-compatible pacemaker. Some are, some are not. So, you fill out that sheet, the technologist will go over it, they'll show it to the radiologist, and, we'll determine whether or not it's safe for you to be in that MRI environment. Nowadays, the joint replacements that are being done, they're all with MRI-compatible materials, and so that's usually not an issue.
All right, so thanks so much for joining us. One last question for Dr. Silver. How does the patient know, or how can the radiologist know if they have the implantable one that can go in the MRI? Is there a name?
So there's, well, the name of it's a SureScan technology. So there's the Medtronic Revo and the Medtronic Advisa are the names, but patients should be given an ID card when they get their pacemaker, and that labels it as being an MRI-compatible system. And radiologists like Dr. Friedman, they have one other good way to do. If you look at a regular chest x-ray, there are special markings on both the pacemaker wires and the pacemaker generator itself that labels it as such. So even if the patient isn't sure, just by doing a simple chest x-ray, we can always find out if it's safe.
Great information. Thank you so much for joining us today. I know our patients out there and our watchers are going to take note to this, and hopefully the physicians out there watching as well will get some great information. Thanks so much for joining us.
Thank you.
See you in St. Pete.
You betcha.
Now, doctors say between 50 and 75% of people with pacemakers may need an MRI at some point in their lives. That's it for today's In Depth. As always, you can see this